Okay, good morning everybody. I am Dr. Rajita. Okay, good morning. I am Dr. Rajita Esther. I wanted to do this particular presentation because of the previous presentation was not that much clear. So here I am discussing about the uses or different techniques of the local anesthetics. So these are the different processes where we are using as a local anesthetics. So when it comes to the surface anesthesia, surfaces we are keeping those particular local anesthetics over the surface or locally. Locally means when we are doing endoscopy, so there we are keeping inside, but it is locally only. That's surface anesthesia. So what are the uses of the surface anesthesia? When we are applying topically or over that particular place. So when it comes to the eye, the tonometry for the intraocular pressure measurement. Cataract surgeries, some of the ocular surgeries, mainly we will do with the surface anesthesia. Nose and in the ear we are using as a drops to relieve the painful lesions and the polyps. Polyps start to be removed due to the pain. Mouth and the throat in the stomatitis, sore throat and painful ulcers. In the pharynx and the larynx and the trachea and the bronchi, we will use for the tonsillectomy, endotracheal intubation and endoscopies. The proctoscopies also we will use. Esophagus and the stomach, gastritis, esophagitis and heartburn. And abraded skin, ulcers, burns, itching and dermatosis. Intact skin for the IV cannulation and the skin surgeries. Urethra, dilatation and curetization and also catheterization we will use. Anal canal and the rectum, fissure, painful piles and surgery and the proctoscopy we will do use surface anesthesias. Next, different types of the injections. Among them, they are again infiltration anesthesia where the drug will be given subcutaneously. There are three types where that subcutaneous drug only will be given but in a different forms. One is the local infiltration, another one is the field block or the nerve block. This field block and the nerve block will comes under one kind of the thing I'll discuss. Infiltration anesthesia. The infiltration anesthesia, the sensory nerves and the ending sensation will be blocked. Examples where we are using these particular infiltration anesthesias are in the incisions and the excisions and the hydrocele and the angiographies. We are using the infiltration anesthesia. And the area will be the relatively area to be anesthetized is the smaller and the larger amount of the local anesthesia is required compared to the anesthesia. Next, conduction block. Conduction block divided into field block and the nerve block. Okay. In the field block, here also as I said, local anesthesia will be given subcutaneously, but at the particular field. So at that field, whatever the nerves are supplying, those nerves will be blocked. Sensation will be blocked. So, what are the uses of the field block? Herniography, appendicectomy, dental procedure, scalp stitching, operations on forearm and the legs. We will do for the conduction block. Next, nerve block. In the nerve block, here that particular supplied nerve will be blocked. Okay, the supplied muscle supplied by the injected nerve or the plexus will be paralyzed. So, this is nerve block, where we can use, what are the uses of these conduction block or the nerve blocks are for the lingual different nerves which we are going to block are lingual nerve, intercostal nerves, ulnar nerves, sciatic nerve, femoral, brachial, trigemic, geminal nerve, and phrenic nerve. They can be used for the tooth extraction, operations of trigeminal, facial, eye, limbs, abdominal wall, fracture setting, trauma to ribs, neuralgias, persistent hiccups. For the persistent hiccups, phrenic nerves. For neuralgias, normally if I have the hypersensitive of the trigeminal nerve like that, or any sometimes the facial nerves, those are also can be blocked basing on the condition. So here I clearly seen this is the infiltration anesthesia where the some part of the nerves are blocked. This is the another above one is the field block. So whatever the field, whatever the nerves are there, they will be blocked. Here the nerve block. So the whole nerve, wherever it is supplying, all that area will be blocked and loses the sensation. Spinal and epidural anesthesia. This the spinal anesthesia is go into the spine and epidural anesthesia over the epidural. So spinal anesthesia, local anesthesia is injected in the subarachnoid space between the L2 to 3 or L3 to 4 below the lower limb of the spinal cord. So the primary site of action is the nerve roots in the carda equina rather than uh, the spinal cord. Lower abdomen and the hind limbs are mainly anesthetized. So when we give the next uses, spinal anesthesia is used for so many kind of the operations which in the lower part of the bodies like prostatectomy, fracture setting, obstructive procedures, cesarean sections. So which are involving the lower limb, pelvis and the lower abdomen. Okay, and during the pregnancy because of the inferior vena cava compression, so there will be engorgement of the vertebral system, so that subarachnoid space will be capacity will be decreased. So the amount which required, the injection amount which required is become less. That is spinal anesthesia. Epidural anesthesia, I told you in the primarily the nerve root in the space of the epidura, in the epidural as well as, so that these particular drug permeate through the intervertebral, mainly first epidural, next diffuse into the subarachnoid space, and even some amount will be permeate through the intervertebral foramina to produce multiple paravertebral blocks. Basing on the site, they are again divided into thoracic, lumbar and caudal epidural anesthesia. Let's come to the thoracic epidural anesthesia, where the local anesthesia given at the mid-thoracic region. So the epidural space in this region is relatively narrow. So where we are using this epidural anesthesia, thoracic, in the pain relief following thoracic and upper abdominal surgeries. So actually the major surgeries of the thoracic, the cardiac surgeries, bypass surgeries or upper abdominal surgeries, all we are doing with the general anesthesia, and post-operative pain management we are doing with this particular thoracic. Lumbar will be at the lumbar space as it is when we are surgeries we are using for the spinal anesthesia. Those are all surgeries can be done by using the lumbar. Okay, caudal injection will be at the given at the sacral canal through the sacral hiatus. This anesthesises the pelvic and perineal region. So mainly we are using this particular type of the anesthesia for the vaginal delivery, anorectal surgeries or genitourinary operations, we can use these kind of the anesthesia. Another one is a Bayer's block. Here we are applying the cuff above the place where we have to do the give the local anesthetic injection. That cuff will be inflated and stopped so that the blood supply will be stopped at that particular place, and below to that prior to the cuff which where we applied, we are doing injecting the anesthesia and doing some of the procedures whatever required in this. In the lower limb we cannot do this. It is convenient to do in the upper kind of the limbs using this base block. So this is all about the different procedures of the local anesthesia. In the next session I'll discuss about the uh, uh, adverse effects or complications of the spinal anesthesia. Thank you.